Well, good morning, Bethany. How are you today?
Excellent as always.
We have a big event going on over here today. We have a health fair.
Yes, we do. It's our second annual health fair.
Oh. So now what happens at the health fair over here?
We have, actually at this point, I think we have about 40 vendors here today.
Good turnout.
All sorts of things. Town departments that are very helpful to seniors in the general community. We've got home care agencies. We have assisted and independent livings. We've got representatives here from organizations like Shine and Circle Home and Community Teamwork.
I see Trinity is here.
Yes, Trinity is here today, and I hope you get to take a video tour of the ambulance at some point.
Oh, that would be great.
They are here with the stretcher that they use and a mannequin to show people how they use it. And they've also got the ambulance here set up for people to tour the ambulance.
Wow.
Makes it a little less scary for people if they're in it for the first time, if they've been in it to visit once before.
I don't want to be one.
I know. I know.
But anyway, my name is Gay Corey, Bob Corey behind the camera. We're from Dracut Access Television, and we're at the Council on Aging today, and it's a pretty exciting event. I hope you're able to come down, and if not, you'll be able to see it on TV.
Thank you guys very much for being here to tape it, and to the community at large. Please check out our newsletter. We have lots of fun events and educational things like the health fair that we're doing today all the time.
And don't forget, October 22nd, we have our big craft fair coming up.
Oh, that's right.
Oh, don't forget that.
I know. We've already got a bus driver lined up to do
Wow.
transportation.
Lots of Christmas shopping.
Yes, very much so.
All right, well, thank you for having us, and we're going to mosey on out there and talk to people.
You guys all enjoy the fair.
Thank you.
Thanks.
Well, good morning, folks. What's going on over here today?
We're just here for the clinic today. Where actually my name's Ken McMiniman. This is Kevin Healy.
Hi, nice to meet you.
Hi,
We're
nice
with
to
the
meet you.
Dracut Fire Department, and we're here for the clinic. Actually, we're talking about fire safety. One of the big things we're talking about today is this device right here. It's called a bed shaker.
Oh, let me see.
It's basically for the hearing impaired. And basically what happens is people that have a hard time hearing, obviously your regular smoke detector's going off, they can't hear it.
Oh.
So what this device does, it basically, this gets mounted underneath your mattress.
Oh.
And when the smoke detector goes off, it activates it, and it shakes your mattress.
Isn't that something?
Yes. So that's one of the things we actually
Well, I think I could probably use one of those just for Bob.
telling people about.
You know?
Along with other.
I'm only kidding. But he does have a hearing problem, just with me, I think. But
So that's one of the things.
what is that called?
It's a bed shaker.
Oh, wow. Is that something new?
We installed a couple of these for people last year, and we're going to be talking to a lot of people today about this, along with other things, cooking fires, electrical fires.
Oh. Tell me.
A lot of times people cooking, they wake up in the morning and they go downstairs with their bathrobe on, and what happens with your bathrobe, they reach over the stove,
That
the
catches.
sleeve catches on fire. Electrical fires, people run extension cords underneath carpets.
Oh, yeah.
Over time, the rubber jacket on the outside wears off.
What do you do for if you catch on fire like that? Is it salt or water? What do you normally put?
Stop, drop, roll. You
Stop,
ever-
drop,
no. Depending on how it is, but basically, obviously you want to take it, get it off, but grease fires, put a lid over it.
Because I know my gas stove is very sensitive, and sometimes if you just put anything on it, it'll ignite. It just
Yeah, you-
comes right on. It's very, very sensitive.
With grease?
No, it just comes on. I mean, like the little knob.
Yeah.
If I put like this on top of it and accidentally hit the handle, it'll click it on. You hit click, 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 and then it'll
Right,
come
that's
right on.
electric ignition on it. That's
the
what
ignition just-
that's what should happen.
When I'm not there? No,
when
no.
you-
No.
That's not a good thing.
No, that's why I said it's very sensitive. I don't know how you control those knobs any better, but
The cat did it.
the cat did it once.
Really?
Yeah,
You should
got up on the stove.
get it looked at.
Look at the cat. Luckily, the cat didn't catch on fire, but So let's talk about smoke alarms. It's that time of year now.
Okay. You want to talk about that?
Smoke detectors, yeah, sure. We suggest changing your batteries twice a year. if it's battery operated. A lot of them are hardwired in with a battery backup. And we usually say to do it when you change your clocks, which is this month. I believe it's the last Saturday of October.
Oh, is it?
So we tell people you change your clocks back, change the batteries in your smoke detector, and everything's great.
So it's spring forward and fall back. That's the way it goes. Well, thank you.
We're also reminding people to make sure if they have their house vinyl sided or their siding changed or anything else like that, to make sure their house numbers are back up on their house so that we can see them from the street as well as police or anyone else. In the nighttime, sometimes it's difficult to see the house numbers. If there's none at all, you're not going to. It's more difficult to find the emergency.
Now, do we have any Halloween tips for children for going out with their lights? Do we have anything that keep them safe on the streets?
Just basically, especially with the little kids, go out with their parents.
Right.
Obviously, flashlights across the streets and crosswalks. Don't dart out into the traffic.
Right.
And obviously, have your parents go through your candy
Right.
at the end of the night.
To make sure it's
Correct.
that's a good thing.
Yeah.
And then whatever's left over, the parents get to keep and eat, right?
Right.
That usually probably happens every time.
Save the best anyway for you guys. Well, thanks so much for talking with us this morning, and have fun today.
You're welcome.
Thanks for coming over.
All right.
Thanks for having us.
You're welcome. Good morning.
Hi, I'm Helen from Senior Whole Health.
My name is Gay, and that's Bob from Dracut Access Television. And what do you have for us today?
So, Senior Whole Health is a no-cost health plan for seniors who are 65 and older and have Mass Health Standard. With Senior Whole Health, what we do is we combine your Medicare benefits, your Mass Health benefits, and we add more to it. So, some of the things that we cover are transportation. We cover all medical copays, all your prescription copays.
Wow.
We provide transportation to and from doctor's appointments. You also give a free gym membership to the YMCA.
Isn't that nice?
It is very, very good. And also, you also get a Healthy U card. It's like a little debit card. You get $35 every quarter for things such as toothpaste, lotion, Tylenol that you can
What a
get.
nice program.
It's very nice, over the counter. You can go to Rite Aid, Walgreens, CVS.
Wow.
So it's a very good program. The requirements are 65 and up, Mass Health Standard, no-cost health plan for seniors.
Isn't that wonderful? Now, where are you located?
So we're located Cambridge and Bridgewater.
Oh.
But we have a marketing specialist like me that we work out of different territories. Like I work out of Lowell, Dracut, Tewksbury, Chelmsford, a lot more other towns. And so if there's any questions, I would be the one to contact. I can go to the house, fill out the application, and help the members from there.
Now, do you have a phone number?
I do.
Okay.
Okay, so it's 857,
Is this yours or is this
my work number.
you want to give your home out?
It's 857-500-0340. My name is Helen, and thank you.
So show me what you have here today.
So we're just giving out, it's a little dental kit. Comes
Oh, isn't that
with
nice?
toothbrush, dental floss, and this is a little stress men, like
Oh,
when you're stressed
boy,
out.
we need those.
I know. That's why I brought plenty of these.
That's terrific.
So if anybody would like to come by, just grab some information, take a few giveaways.
Sure.
Yeah.
All right. Well, thank you for talking with
Thank
us.
you.
What's your name?
My name is Susan Casal, and I'm from Pure Salon and Spa in Dracut over at 155 Broadway Road. I'm a licensed massage therapist in Massachusetts.
Boy, I could use one of those.
I know. I know. It's really good. It really changes people. People come in. I see them. They're very stressed out. You can be wound up emotionally. You can be wound up physically. And then people come in, and then they're different when they leave.
The music is very relaxing over here.
It is. It's
Very soothing, actually. I can just sit down and take a little nap now, you know.
yeah. It's angel music.
It's very nice. I like it.
What's interesting about this music is it's different from other music. That other music can be predictable, and your brain tries to predict the music as it's happening. This music does not go to a certain pattern, so your brain can't follow it. It can't predict it. So
Even
you
though
just
it's in
let
the
go,
background,
and you can enjoy it. Yeah,
I am
yeah.
enjoying it very much. So now, do you go to school for this?
I did. I went to school for 2 years. Yep.
So you're located in Dracut over...
Yep, over on Broadway Road.
Do you have a phone number?
978-674-8188, and our website is puredracut.com. We're on Twitter and Instagram and Facebook, all that stuff.
Oh, that's great.
Yeah, we're offering a special for Dracut senior citizens. I have little cards. We have a special until New Year's.
Wow.
$20 on Thursdays only for a cut and style, because I'm a massage therapist, but we are a hair salon. We do facials.
A little of everything there, huh?
Yeah, yeah.
So one-stop shopping.
It is, it is. We have a very, very calming vibe. People come in, they say, oh, as soon as I walk in and I smell this room, I know I can relax and I'm taken care of.
Is it lavender?
No, it's the Aveda smell. It's part of it's lavender, part of it's little peppermint. It's just very calming.
Oh, that's nice.
You should come in and check it out. I'll make you a cup of tea.
Okay.
Yeah,
Sounds like
we got a
fun.
nice fireplace. You can sit down.
There you
read
go.
A magazine.
We can make a day of it, Bob.
No, you know what? I give a hand massage to anybody who comes in. If
Really?
they've got a little bit of extra time, if I have time. Yeah.
That's great. We would love to do that. Thank you.
Come in and see me.
We will.
Okay,
Thanks
you.
for talking with me.
Sure.
Well, good morning. How are you?
Lovely. How you doing?
Good. What is your name?
Ed McGovern. I'm with Comfort Keepers. We're an in-home senior care. We do everything from personal care to homemaking to transportation. The goal is to help keep seniors in their homes through their elder years and keep them safe, keep them nourished, keep them healthy.
That's terrific. Where are you located?
I'm located in North Chelmsford, and I serve the greater Lowell area: Lowell, Tingsboro, Westford, Billerica, Chelmsford, Lowell, Dracut, Tewksbury.
I saw you dancing. Is that part of your...
No.
I thought you were dancing to the angel music, you know.
No.
You got uplifted.
Background antics.
Is that what it is?
Yeah.
Background music? Well, thank you for talking with us.
Oh, thank you.
Have a good day today.
Have some treats.
Danger, danger. Well, good morning. What's your name?
My name is Mimi Flannery. What's your name?
Gay Corey. Bob Corey behind the camera. We're from Dracut Access Television.
Hi, great.
So tell us what you're doing here today.
I'm here today for the Mass Commission for the Blind. And we are a state agency that we go see people who are legally blind in the state of Massachusetts, and we provide services for them. And we have support groups all over the state, and we go see people in their house. And so if anyone becomes legally blind, there's a lot of help for you.
And how would somebody reach you?
Well, it's mandated by state law that if you become legally blind, your doctor contacts us. Your eye doctor contacts us. Or you can call us directly at the Commission for the Blind.
Do you have that number?
The website.
Or the website?
Sure. The main number I'm going to give you is 6. Nope, she doesn't have the main number. The main number for the Commission for the Blind would be 617-727-5550. And also we have a website, so if you go to mass.gov/MCB.
Okay.
But there's a lot of help, and if you become legally blind, your doctor will report you. And if he doesn't, you can tell him to do it because there's a lot of financial incentives. If you own property in the Commonwealth, you usually get $500 to $1,000 off your property taxes, which is nice.
very
And there's a lot of services that you don't have to pay for. So, and most of our clients don't become totally blind. And we like people to know there's a lot of help. Also, if you're in Dracut, there's Lowell Association, who's also here today, and they're wonderful. And we partner with them, yes. Yeah. So just know if you're having eye problems, there's a lot of help for people. And we can also direct you before you become legally blind for a lot of help.
Oh, that's great.
Yep,
And
yep.
Is this a magnifying glass?
That's a magnifying glass.
Boy, could I use one of
Oh,
those.
please take one. And do you want some?
It helps when you're reading. Oh, sure.
Can you tell what I was quickly doing this morning? This
Well,
big plate. I was painting a bookcase quickly this morning.
I said I kind of blend in with your table here.
Yes, the tablecloth, the old Christmas tree, but goody.
Listen, he doesn't let me go go there very often. I have too much fun
Oh,
at the
is this your
Christmas tree.
husband? Oh,
It
I
is
know.
my husband.
Oh, yeah. Oh, she's saving you money.
No.
And we're helping the economy.
He says, no, you can't go to the Christmas tree. I said, okay.
My mother used to say, oh, my goodness, you don't need it. You don't need it.
I know. But then you get there and say, I could really use this.
I know,
You know,
I know.
and
And
it's
it-
just fun stuff, you know.
Yeah.
You gotta have some fun stuff.
Yeah. Well, great.
Well, thank you very much for talking with
Okay.
us. And you have a wonderful day today.
I will. I'm so
We're
glad.
all set, Bob. Got a
You're all
magnifying glass.
set, and you can always call us for any, we can refer you before you become legally blind. And just know, if anyone's having visual problems, there's a lot of help out there.
Well, thank you for being
We're
here.
very lucky to be in the Commonwealth.
Thank you.
Thank you.
I was just saying, what is your name?
Hi, I'm Mark Armstrong. I'm an attorney in town.
Nice to meet you. My name is Gay Corey, Bob Corey.
Nice to meet you.
I was just saying, this lady gave me this chart. You're supposed to put it on the wall and read the directions. And if this starts going wavy, you need to go to your eye doctor to see if you need glasses. What do you think?
I think I'm due for
An exam, are you?
exam, right.
Yeah, that's terrific. So tell me what you're doing here.
Today we're just offering some folks free healthcare proxies. It's through the Honoring Choice Massachusetts program. I'm a community partner with those folks, and it's basically it's a do-it-yourself healthcare proxy. I mean, most people know they go in for surgery, some kind of procedure. The healthcare professional is going to have something in their file that they want them to fill out right then and there. It's a good idea to do one on your own ahead of time to think about it, and then share the copies with the physicians as
Now
well.
you say healthcare proxy. What exactly does that entail?
Well, the healthcare proxy is basically going to give probably your loved one, a friend, a family, someone, the authority to speak with the physician and to
If you're incapable.
if you're incapable, right? So if surgery doesn't go so well, things like that.
Yeah.
It's important for the seniors. Really, it's important for everyone.
Absolutely.
Everyone who's over 18 can't have one, and they really should.
Lets me out.
Yeah. There's a lot of. What's that?
That went right over your head. I said, lets me out.
Oh.
He just ignored that. It's okay.
Well, even children going to college. I have a daughter who's going to be turning 18 next summer, and she'll be heading off to college, and we'll make sure she has the documents in
That's
place as
nice.
well. So, bad things happen to people. It's unforeseen events. You want to make sure you.
Do you have a website?
Well, I have a website. Sure, I'm attorneyarmstrong.com.
Okay.
Nice and simple, and we do estate planning, probate, guardianship, conservatorships, mass health planning, helping folks out with mass health applications. We run the gamut. Whatever you think the estate planning umbrella might encompass.
Where are you located anyway?
I'm over in Dracut Village Square on Broadway Road, right across from the post office, near the old Ding Ho, over
Yeah.
that way by Frobe's, right next door.
Oh, yeah, right next to Kirby's.
Sure,
Oh,
yeah.
that's terrific.
So,
Well, thanks for
That's
talking with us this
Okay.
morning.
my pleasure.
Have a
Thank
fun day.
you. We will. Always do. Thanks.
Well, good morning.
Good morning.
What's your name?
Kirk Brigham.
What's your name?
Sean Hunter.
Welcome. Thanks for being here today. You're from Trinity Ambulance?
Yes, I'm the Director of Clinical Services, and I oversee education for Trinity.
That's terrific.
Yeah.
So what are you going to tell us today?
Well, we actually brought a mannequin here today, and we have an automated CPR device.
Oh, it's automated now?
Yeah, it does chest compressions all by itself.
Wow. I know Bob and I took the class. We got our CPR.
You did?
Yeah.
Okay.
I had a hard time pressing on that little guy.
So that's the problem. We get tired after about 2 minutes
You do.
of manual CPR. So this device does CPR all by itself. It does the compressions for you.
Oh, can you give me a demonstration?
Sure.
Okay. So how are we doing now?
Good. So we have an automated CPR device.
Oh, look at that thing go.
The device takes over CPR compressions and it does it for us. As people, we get very tired performing CPR. So after about 2 minutes of manual CPR with my hands, I would tire out and my chest compressions wouldn't be as accurate. So this device takes over and does the compressions for us.
Now, how long does that stay on?
It stays on for the duration of the treatment or until we get pulses back on the patient.
Wow.
Yeah.
That's amazing.
And we can actually bring somebody down the stairs out of a house with that on.
Really?
Yep.
That's outstanding, you know, because otherwise you'd be doing the compressions by hand. And I know we took the CPR class, and it is very strenuous on you when you're doing it.
It is very strenuous. It is.
Found it to be anyway.
Yes.
It's a good thing mine wasn't a real patient, because I don't think he would have made it. Poor guy. I'd still be working on him.
Absolutely.
But that's great. I thank you for coming over here. And that's amazing.
We have this on all of our ambulances that have paramedics on board. Yes. Yep.
Now, did you bring your ambulance with you today?
We did. Yes. The ambulance is out front.
Oh.
Brand new, 2,000 miles on it.
Really?
Yep.
Wow. Hot off the press, huh?
Hot off the press.
That's terrific. Is it very loud in an ambulance? I mean, knock on wood, I have not been in one. I don't want to be if I don't have to, but...
It depends. If people don't move, it gets louder. So remember, pull to the right.
Pull to the right.
If you hear an ambulance, pull to the right.
Oh yeah, definitely.
Yep, pull to the right.
I know some people don't pull over when they see.
Well, people now have their phones hooked up to their stereos, so they're listening to music.
Or texting.
Having earbuds in, not texting, not paying attention.
Right.
Yeah, we do run into those issues.
And that's too bad, because you've got somebody's life to save.
Always.
So.
Always. If an ambulance has the lights on, then it's serious.
Definitely move. Well, thank you.
You're welcome.
I'm glad we came back, and good job. You know, I meant to ask you, is there a number that people can call?
Sure, 911.
Right.
For emergencies.
Right.
But we also have an office number as well.
Mm-hmm.
And the office number is 978-441-9999.
Okay, now what happens when they get that number?
So they won't be routed to the police department first. They'll be routed right to one of our dispatchers.
Right.
And one of our dispatchers will dispatch an ambulance, and they can also notify the police as well if it's an emergency and they'd called the main number.
Oh, well, that's good.
Either way, you'll get the same response.
Oh, that's good.
Yes.
What is the general turnaround time when you call an ambulance? Is it?
So our response times are 4 to 5 minutes on average.
Yeah.
And the maximum is about 8 minutes. But you'll get fire department first, police department, there's the first responders.
Right.
They're located in different firehouses throughout the town. The police department is always out and about. And then we have 2 ambulances in this community as well.
Oh, that's great. Well, welcome to the community.
Thank you.
Glad to have you here. Good morning, girls. How are you?
Good. How are you?
Good. Tell me your names.
Riley, Cecilia, Nicole, Kate.
And what are you girls doing here today?
We're UMass Lowell nursing students, so we're just raising awareness for breast and lung cancer.
Oh, that's terrific. How long of a course is that?
It's a 4-year program.
Wow.
We're graduating December.
Are you?
So we'll be done.
Good for all of you. 4 more nurses. We need you. I was talking to Trinity over there, but their patient wasn't doing too well. Unfortunately.
We're here, yeah.
So what would you like to tell me here? What do you have here?
It's in the
Oh,
front,
it's in the front.
Yes.
Well, let's go to the front. See oh, you have somebody out here in the front? Look at these girls are hiding out. Look at. Come on over here. She's busy. You want to be on? You want to be on TV?
What do you want me to say?
Well, whatever you would like. First of all, tell me your name.
I'm John King.
Nice to meet you, John. My name is Gay, and that's Bob.
Hi.
So what are you doing here today?
I'm visiting so I can learn some more things and get some food to eat.
Oh, they have food here?
I have food there up front.
Oh, yeah? What do they have? Anything good?
Cookies, cake.
Wow, all good stuff, huh?
More or less that type of thing.
That's terrific.
But I'm here to get smarter.
These girls are very smart. They're all graduating this year, so we got 4 more nurses.
Okay, well, I'm looking for a date. See you later.
All right, have a good day. Okay, so now what are we doing here?
So this is just information on...
This is the chocolate. Okay. I don't know if you can see it or not. Okay,
So because the Dracut average is greater, the rates for incidence in cancer is greater in Dracut than it is in the state. So we're just raising awareness. We just have information on what to look for, risk factors, diagnoses, and we printed out brochures that they can take home.
Oh, that's nice. Very good. Well, thank you for talking
Thank you.
with me. I guess we're done here. Well, good morning. How are you?
I'm doing great. How are you?
Good. Tell everyone your name.
My name's Lynette Duggan, and I'm the owner and president of Right at Home In-Home Care.
Oh, that's terrific. So what do you have here? What kind of services do you provide?
We provide companion care and personal care to anybody over the age of 18, mostly elderly folks. We also do transportation services. So if they want to go to the supermarket, or if they want to go to the hospital, or a doctor's appointment in Boston, we transport them there.
How long have you been doing this?
A year and a half in this business and 26 years in healthcare.
Wow. That's
So I love it. Yeah, it's great.
It's a good program. So,
Absolutely.
So what do you have? It's called Right at Home?
Right at Home, yeah.
So we have a number here. We have 978.
751-8700, and we're open 24/7. I'm on call.
That's terrific. So you actually you go pick them up at their homes?
We do.
Oh.
Yeah, we bring
It's
them
a
there.
good service.
Yeah, I mean, a lot of the companies don't have transportation, but we're finding the elderly folks aren't comfortable with their own cars anymore. So we bring them to the doctor's appointment, and it's safer than Uber or a taxi cab.
Absolutely.
And
it's cheaper too.
It's cheaper, yes.
Much cheaper.
Much cheaper, yeah. We love it, though. It's nice.
Well, thank you for doing
My
that.
pleasure. Welcome.
Well, good morning. How are you today?
I'm fine, thank you.
What is your name?
Linda Blumgren. I work at Community Teamwork.
And who's this gentleman here?
I'm Alan Trebat.
And you work at?
I work at Community Teamwork, as Linda does.
Oh, you're together. Okay.
I work with the Senior COA programs.
Oh, no.
All three.
What kind of program is that?
Senior Companion Program, Foster Grandparent Program, and the RSVP Program. So these programs have been with CTI for over 50 years. And we have volunteers in the greater Lowell area. Seeing a lot of seniors in private homes, assisted living facilities, adult day facilities, senior housing, and we also have volunteers in elementary schools, daycare centers, again as far away as Shirley, Mass, and they volunteer a minimum of 15 hours, some volunteer up to 40 hours per week. So it's a wonderful program.
So how would anybody get in touch with you? Do you have a website?
Yes, we do.
And what is that?
And that is right here. We have it's at excuse me. It's on our website, www.comteam.org.
Okay.
Okay, and you can find out all about the Senior Corps programs. And like I said, we have 2 stipend programs.
Oh, you do?
Yes, where volunteers are eligible under our guidelines, and they receive a little stipend a month.
That's nice.
Yeah, and you know that, like I said, they volunteer a minimum of 15 per week and go up to 40 or 30 or 20. And this stipend helps them out a lot, and it's not considered wages, so it won't affect where they're living in senior housing.
Oh, that's
so we have volunteers that have been on for 5, 10, 15, 20, over 30 years.
That's excellent.
Yes. So they love what they're doing. Because of what they're doing, they're staying healthier.
Oh.
Yes, and if they do have a setback or they're in a hospital for, a short time, their recovery time is so much quicker because of what they do every day. So love being with the seniors. A great, wonderful, wonderful program at CTI.
Well, thank you very much for being here. You're doing a good job. She did all the talking, but I just want to let you know you're doing a good.
I've got a different program.
Oh, you do?
Whoop, here we can. I don't want to stand in front of you though.
Let's drop seats.
Yeah. So I'm Alan Trebat from Community Teamwork, and I'm here with the Home Modification Loan Program. We can provide funding through the Mass Rehabilitation Commission for people who need accessibility modifications to their home. It's a program serving seniors and also serving any individual who has disabilities. So if somebody needs a ramp for access to their home, a safe bathroom, a stair lift for inside the home, or it's a fairly broad program. We've been able to pay for fencing for somebody who has an autistic child and they want to be able to have their child play in their yard. So it's very, very broad for...
It's a good program.
Thank you. For seniors, for people with disabilities, in order to stay safe in their home and be able to get in and out of their home safely.
Right, absolutely.
Yeah, and it's a state-funded program. There are pretty much no costs to the program.
Is your phone number the same as the website? Are you the same, or is yours different?
My phone number is different. My direct dial number is 978-654-5741 if you want to learn more about the home modification loan program.
Okay. All right, that's good to know. Well, thank you for talking with me. My name is Gay, and that's Bob Corey behind the camera.
Nice to meet you both. Nice to be here today.
Thank you. Thanks for being here.
Good morning. My name is Pat Westbury. I'm from Lowell. I'm with the Senior Medicare Patrol. Senior Medicare Patrol, we deal with fraud, Medicare abuse, and billing problems. If there's a problem, we need to know about it, but you have to keep track of all your billings from Medicare summary report to keep track of it. And we have a manual. We have this manual. You need to keep track of all your doctor's appointments.
Oh, that's a good thing to have.
Tests and everything. If there's a problem, we're on the back. We need to know this. This is the only way we can stop.
Is it a website or?
You can go on the website.
And what is that?
Well, you can sign up for it here. It's just smp.org.
And where are you located?
In Lawrence.
Oh, you're in Lawrence.
Yes. But this is your only proof. If you keep track of stuff, it's the only proof to stop these people from billing and doing extra stuff that you shouldn't. And plus, our sister company is Elder Service. Elder Service take care of people at home, needs, transportation, food, Meals on Wheels, medical equipment. So if you can't get in touch, come to your nearest child counselor, and they're at Council of Aging and they're at senior centers. They can help you. They can't, then they get in touch with us.
Okay. Now, do you have a phone number?
It's right here, ma'am. 800-892-0890. And both of us will be happy to help anybody out there in any way we can.
All right. Well, thank you for talking with me. Very nice to meet you. My name is Gay, and that's Bob.
How you doing?
Oh, this is good. I'm always losing.
You want one?
Sure. Oh, thank you. Appreciate that.
It's best you keep track of everything because...
Yeah, I don't. I forget. If I don't write it down, I'll forget.
The only way we can control it, people need to help us out by something that may not seem a big deal could be a very serious problem. You can always call us whenever. We don't care how big or how small. They could answer. If we can't have an answer, we'll find an answer.
All right. Well, thank you for talking with me. Nice to meet you. Well, good morning.
Good morning. How are you today?
Long time no see.
It has been a while. I'm Jim from Senior Helpers. Great to see you again.
Nice to see you again.
So we're here today to talk about in-home care. We provide in-home care for seniors, everything from 3 hours to 24/7. We do live-in care. And I know from our previous experience that you know a lot about our Alzheimer's and dementia program.
Right. Well, please tell the public about it.
So we have a very unique training program for all of our staff. We also extend it to families and to professionals, nurses, social workers, called Senior Gems. And it's a different way of looking at the disease. It talks about and it trains our staff on what you can do with somebody that has a memory issue. Rather than thinking about all the things they can't do, we focus on what they can continue to do. And understanding the transition of the disease families and as the care needs change. So it's a terrific training program.
So tell us how you can be reached.
So our contact information, we're located in Westford, but we service kind of the greater Merrimack Valley. Our phone number is 978-467-4300. You can ask for Jim, ask for Jay, ask for Elizabeth, so anybody in our office.
That's terrific. Now, is this gentleman with you? Jay is with you. How do you do? Nice to meet you.
Okay, we'll let you get on TV.
Oh, yeah, thank you. My name is Gay, and that's Bob. Every booth I go to, John is there.
Oh, really?
I just met him.
You just keep on following along?
I think so. So how long have you been with this program?
Well, I've been with Senior Helpers since December. But I'm a Dracut resident, though, actually. So yeah, I know the area quite well.
Oh, that's great.
Yep.
And you're working with him?
I'm working with Jim, and I do the outreach, so I reach out to all the Council on Agings and all the different assisted livings. And
I think there was a woman with you last time when we did the show in the library. What was that? Was she a nurse?
Yes. We had our nurse. I believe Denise was with us. I think Denise, our nurse, was with us.
Yeah, I know she. When we did a show with them, was it 2 years ago?
Gosh, has it been that long?
I think it has been. Yep. Yeah. We still have the copy at the studio anytime you want to re-air it.
Yeah.
Excellent.
That's great. Yeah.
Yes, that'd be great.
Yeah.
That's great. Anything else you want to tell people?
Well, I mean, Jim and I just reach out to families. You know, we can go out and we can talk to the family in their home, kind of get an assessment for the surroundings and what we can provide for care.
How would you tell somebody that they're having the onset of Alzheimer's? How would they determine that?
Well, you know, it's about finding out. Everyone's different. You know, every situation's different. So it's about just working with them, understanding where they are and how to care for them, understanding the different stages of dementia and you know, how to work with them, how to meet them in their place and make them feel most comfortable.
Oh, that's good.
Yeah.
Yeah. Anything, Jim?
Well, the only thing I'd like to add is that November is Alzheimer's Awareness Month, so there is certain locations where memory screenings are done. We've done memory screenings here in the past. I'm not sure if we're going to do it this November or not.
So where will you be doing it?
We haven't finalized our schedule yet. But
so will you post it on your website?
It will either be on our website or it will be on the Alzheimer's Foundation of America's website. They also post it there. That's probably a good place to start. It's a fairly simple 10-minute process where a nurse or social worker asks you some questions, and really what it does is it'll highlight a need to actually schedule time with your general practitioner to do a full workup. So.
Okay, well, thank you for talking with us today.
It was great to see you again. Thank you for stopping by the table.
Have fun.
Nails.
Thank you. Just had them done. See, I got Dracula. Well, good morning.
Good morning. How are you today?
Good. How are you?
Wonderful. It's our pleasure to be here at the Dracut Senior Center.
Nice that you're here. And what is your name?
My name is Roberta Boyle, and I'm from New England Home Care Solutions here in Dracut, Mass.
Oh, wow. Where are you located in Dracut?
We are located directly across the high school on Lakeview Avenue.
Oh, by the pizza place?
By the pizza place? No.
Oh, no.
Directly across. It's a White House with a real estate agency, 1565.
Oh, okay. You're further up.
Correct.
Oh, now what do you do over there?
We represent, it's New England Home Care Solutions. We do all home care, which is OT, PT, any home services, LPN. We're Medicare and Medicaid approved. And we have a lot of different approvals from Mass Health and all different types of insurance agencies. So we do it all, but the one difference is we are family owned. So when the phone rings, one of the family members answers, nice. And it doesn't matter what time it is. You know, if it's 3 a.m., we're there for you.
Oh, would you check my blood pressure?
I certainly will.
I'd like to have that checked.
Great, thank you.
Well, good morning.
Good morning.
How are you?
Very well, thank you.
I know we caught you by surprise over here, but tell us what you're doing here.
We're from Wingate at Belvedere. I'm Michelle, I'm the rehab director, and we're just representing our company, showing people about what we have, the services that we have.
Now, didn't you provide the food here recently for a function? I think
I believe she did, yes.
I remember that because we came to it, but I For some reason, Wingate was familiar.
Yeah, I believe they just did that recently.
They did, yeah. I thought so. The food was excellent, by the way.
Oh, well, thank you.
I think we had paninis.
Oh, I don't know. I didn't get invited to that, I guess.
You just do behind the scenes, huh?
Well, I'm the rehab director, so I'm usually treating patients as well as managing the department.
Oh,
so
that's nice. So where are you located?
Belvedere, so we're right on 38 on the Lowell Tewksbury line.
Do you have a website?
I believe we do, yes. It's Wingate Healthcare.
.com?
Yes.
That's terrific.
Got it right here if you want to zoom in.
Zoom in. Oh, now she's not shy anymore. She goes, zoom in, please. Good for you. Did you zoom in, Bob? So here's the brochure right here. We'll hold that up. How's that?
Go.
That's bigger. We can see that better. Well, thank you for talking with me. My name is Gay, and that's Bob.
Michelle, nice to meet you. Thank you.
Nice to meet you, too.
Thank you.
Thanks for being at the fair.
Absolutely, anytime.
Well, good morning.
Good morning.
What's your name?
So my name is Joshua Stahowski. I am the Adult Services Coordinator at Lowell Association for the Blind. So we offer support services for people who are legally blind, visually impaired, or completely blind. So I personally run the adult program. So every Tuesday and Thursday during the week are for people who are 22 and up who are our clients. They generally come in. We have a bunch of events listed for the month, and we do things like we'll make breakfast at the office. We went bowling last week.
Wow.
We do other events annually. So we just did last month. We did a Birding by Sound program. So we went up to Joppa Flats in Newburyport, and we actually went to the Audubon Sanctuary, and a bunch of our clients got to go around and listen to the birds, and they did a whole lecture and demonstration for us, which was awesome. They loved it.
That's terrific.
Yes.
How can you tell one bird from another?
So it's actually, they make it very detailed, and so you actually listen to the particular sounds a bird makes. And the people there are very good. They can pinpoint what bird is by what sound, even if it's further away.
Wow.
They're very knowledgeable.
That's excellent.
Yes.
Now, where are you located?
So we are actually located in downtown Lowell at 169 Merrimack Street. So in addition to the adult program, we also have a youth program for kids.
Oh, nice.
And we also have our radio reading service.
Now, what is that?
So we read the local newspapers from 9 o'clock to 12 o'clock Monday through Friday, and we give out free receivers to people who are interested, and they can tune in and just listen to the news during the weekdays.
So what station would that be on?
So we actually broadcast through UMass Lowell, allows us to use their radio station.
That's terrific.
But our radio receivers automatically tune into them.
Oh, wow.
So they're set for that default. And we also, if the radio receivers don't reach, we also offer the streaming of the news on our website.
Oh, now what is your website?
It's LowellAssociationForTheBlind.org.
Well, that's interesting. Now, what does that watch? Is that just a watch, or is it?
We actually offer a bunch of different assistive technologies that we have. So I just brought a few of the smaller items, but this is a talking watch for people who can't necessarily read the time.
Really?
Yes.
Wow.
So we also have other items like a talking alarm clock. We have what are called bump dots. So they're just small items, little bumps you can, with adhesive, you can put on objects around your house as indicators. And they also come in a variety of different sizes and colors, so it makes it very easy to identify what you're looking at when you're going around your home. Then we also we have a Braille instructor who is Dorothy Donovan, and she teaches our clients who are interested, she teaches Braille.
That's excellent. A lot of interesting things here.
Oh, yeah.
And so what is this now? This is the...
So that is a talking alarm
clock. Oh, that's a talking alarm clock. Maybe people don't want to hear that in the morning.
Some people need it. We have a bunch of our clients that actually prefer having those. So they're much louder.
Yeah.
But some of our older clients love that. They've had them for years.
That's great.
They know how to program them themselves and everything.
Wow.
It's amazing.
More than I can do.
And we also offer, so if we don't have the technology ourselves, we offer like magnifiers, readers, large print keyboards. But if we don't necessarily have what people need or are looking for, we also connect them with other organizations such as Perkins School for the Blind and Eastern Seals, Massachusetts, to get them, just sort of the services, but also the technologies that they need.
Oh, Oh, well, thank you for talking with me. That's very interesting. What's your name?
My name is Joelle Weber, and I'm here with All-in-One Home Healthcare.
Oh, very nice.
My nurse Kathy Lumberg is also with us doing blood pressures.
Oh, that's good.
Passing out all our little goodies. We are a new home healthcare agency that opened up. We service the Merrimack Valley area. We have skilled nursing, PT, OT, speech therapist, and home health aides.
Little of everything.
Little of everything. We do.
Do you have a website?
We do. It's All-in-One Home Healthcare at Comcast.net would be our email, and if you go to the email, you'll be able to link over to the website.
That's nice. Now, what services do you provide, you said?
Skilled nursing, OT, PT, home health aides. So usually after surgery, or if someone just needs a little extra help at home.
That's terrific. Do you have a phone number?
I do, 978-258-0917.
That's great. How do you know when your blood pressure is too high?
How do you know when your blood pressure? Your ears might get red and warm. You might get a little palpitation. You might want to call my nurse to do that for you.
What's your name?
Kathy Lumberg. I'm the nurse for All-in-One Home Healthcare.
Nice to meet you. My name is Gay Corey, Bob Corey behind the camera.
I know. I've seen you before on TV.
Well, thank you for
and
watching.
you're very, very
I am.
obsessed to have
Look
Halloween.
at, I have Dracula.
I love it. I am very impressed.
I'm seasonal. The next season, let's see, will be November. I'll be getting turkeys on my nails.
All right. I love it.
She's very, very good.
Yes.
I go to Dracut Nails and Spa, and she's excellent.
All right, there we go.
There we go. I got to give her a plug.
Yep, give her a plug when you can.
Yeah.
So we do everything. We'd love to have you come and have us take care of you. I think a lot of people don't understand that you can choose who you want to come to your house.
You can?
You can choose.
Really?
When you get discharged from a facility and they say you're going to go with this company, if you want another, you get to choose what healthcare agency and what nurse. Make your choices.
How would anybody know which one to choose from?
Okay, so you need to do a little investigation. Most of the companies will tell you exactly what they want, but you look on your websites, do your homework. We'd love to have you try us, and I'd love to come and take care of you.
Oh, that sounds like a plan.
All right?
I think I'll have my blood pressure checked now.
I would love that. Come on, we're going to see how she's doing.
You want to do it on camera?
Yeah, let's go.
All right, let's do it. If it's high, don't show it.
Hey, I'll make it up.
Yeah, make it low. There we go, let's see. I'm almost nervous.
She's nervous.
Yeah, I know, huh? Do I have to do anything?
No, just like that. I'm just going to go right over.
Okay.
Put your hand right here.
There we go. Did I get too much on?
No, she looks fantastic, doesn't she?
Too many clothes on?
I'll go right under.
You can get in there, huh?
I can.
Wow. Good job. Okay, here we go, Bob.
Here we go, Bob. I get a Bob too.
You do?
Oh yeah. Everyone has a Bob.
What does he do?
He's my husband. He works for National Grid.
Oh.
122/60. She's perfect.
Wow.
She has the blood pressure of a teenager.
Wow. That's good, huh?
Yeah, it is very good.
Is 60 too low, or is that?
No, that's perfect.
Wow.
See, there you go. Make your day.
I feel so much better now. Thank you so much.
You're welcome. You have a great
Wow, that was excellent.
You did awesome.
I'm ready to go out and jog and everything now.
You know what?
Not that bad. Well, good morning.
Good morning.
How are you?
I am good today. Back from a long, long weekend, so...
Did you enjoy it?
I did. Was up in Vermont, relaxed.
Nice,
Yeah,
nice.
so-
What part of Vermont?
It's the White River area where my dad's from. We have a lake house there, so
Very
really the last weekend to be able to do stuff on the lake, even though it was kind of cold. So
That's terrific.
yeah.
So tell everybody your name.
My name is Tom Pogar. I'm with the Blair House in Tewksbury. We're assisted living, skilled nursing, and adult day health. So I guess the best way to describe that is, the adult day health is, it's a day program, and I think it's gives you the best of both worlds, the ability to stay at home, and at the same time you get to go out and about during the day and have, you have nursing there on staff. It's regulated at Mass that you have to have nursing. You have 2 meals as well.
Oh, wow.
And an afternoon snack. And the best part is, if you need transportation, they will cover you for transportation as well. Number of insurances covered, including long-term care insurance, Medicare or Medicaid, also known as Mass Health, and VA benefits. Skilled nursing, I think you've probably stopped through a couple skilled nursings in the area. So you know about that. We're a 131-bed facility with shared apartments and private apartments or private rooms for infection control.
Now that's in Tewksbury, you said?
We're located right off of Route 38 in Tewksbury, town center area. Lastly, we have assisted living. What's great about the assisted living, we have 35 apartments. We'll do a spend down program. So if you come in with minimal assets, so you have 6 months worth of assets, you have a place to stay for life. You can spend down into our nursing home, whereas a lot of the other communities in the area, they're just assisted living. So you're on your own after that. But you have a continuum of care here. You age in place, and that's the big selling point for Blair House of Tewksbury, as well as the other Blair House.
There is a fee for that?
For
assisted living?
Assisted living is private pay. They do VA and long-term care insurance. However, like I said, you can spend down on and go on to Mass Health on our nursing home. So, that gives you the best of both worlds to be able to stay on your own as long as possible.
So is there a phone number?
Yeah. Main phone number I can give you right here.
All right.
978-851-3121. And you can ask to be transferred to extension 8674.
Is that you?
That is myself, Tom Pogar. So
There we go.
Where are you guys out of, though?
We're from Dracut Access Television.
Dracut Access Television.
We're
Okay.
volunteers, 23 years.
Wow.
Yeah.
My brothers in the film industry are actually broadcasting, so I went to Syracuse.
Yeah.
I just got out of school at Syracuse, and he's in Indiana in a small station as a weekend anchor. So
That's terrific.
trying to make his way up, and it's not a.
Well, he'll be able to see this, so if there's something you'd like to say to him.
You would probably have a lot of pointers of things I'm doing wrong, but
You can't do anything wrong, You're doing. He's a natural star, so so when you see this, say hello. Call your brother.
All right, my name is Tom Pogar from the Blair House in Tewksbury. Thank you for your time now.
Thank you. I know you just did. I think I can feel my cheeks.
That's okay.
What's your name?
My name is Bonnie Madigan, and I'm a nurse liaison for Alternative Home Health Care.
Very nice. Mine's Gay Corey, Bob Corey, Dracut Access Television. And tell us what you're doing here.
Well, we're a VNA. We operate out of Methuen, Massachusetts. We cover from the North Shore to the South Shore, over towards Lowell and Worcester, and now in the lower part of New Hampshire. So we have nursing, physical therapists, occupational therapists, social worker, home health aides, and a speech therapist that can come into you and provide services in your home.
That's nice.
Yeah, and we cover pediatric to geriatric. So
no, you can't do anything for bruised ribs, can you?
Not really, other than taking like ibuprofen and Tylenol.
Ice.
Yeah, ice. Absolutely. Sometimes heat works, depending on when the injury was, presented. So, what did you do? Fall?
Yeah, I did.
Got to be careful. That's really
rib contusions.
Now, how did you fall? That's my question.
I fell forward on a coffee table.
And why?
I think my blood pressure was low, and I think I passed out.
I just heard you over there. She said that your blood pressure was what?
122/60.
Okay, as we get older now, okay, doctors are actually saying that they want your blood pressure to be a little bit higher than that, okay? Because you are more at risk for falling. Okay. So where your blood pressure is 122 over whatever, and that's great if you're younger, but doctors are actually saying they want it up a little bit more.
How do you
what?
How do you get your blood pressure
Well,
higher?
you want to stay hydrated.
Oh,
Okay.
yeah, I need
there are
water.
medications that actually will increase your blood pressure. There are certain types of foods that can do it too. So I would talk to your doctor, especially where you did have that fall, secondary to your blood pressure dropping. When you go from a sitting to standing position, make sure you take it slow. Do not act
I have to
quickly.
anyway.
Yeah, don't act quickly on that. That's really kind of important.
I think I need water. A lot of water.
And a lot of people don't drink enough water.
Oh, I don't think I do.
So one thing I love to do when I'm out is actually educate. So we are educating on emergency preparedness in disasters, especially in the elderly, to make sure that they have the supplies they need. God forbid an emergency occurs in their area. So whether it's a medication list, a diagnosis list, a contact list, a first aid kit, water, a change of clothing, to make sure that they have that so that they can grab it and either leave where they are to go to another place or to stay put. So it's really kind of important. So there's a lot of great information on our table, and you guys are welcome to it.
Oh, thank you very much.
You're welcome.
And thank you for talking with us. Did I ask you for your phone number?
No, you did not.
Oh, well, by all means, tell me your phone number.
Our phone number is 978. I know. That's what happens. 657-7444.
Now, is that Wilmington?
That's actually out of Methuen.
Methuen.
Yeah, Methuen, Mass. Yep.
Oh.
Yeah, but we cover all over most of the state.
So where are you located, though?
Methuen.
I mean, is it on Main Street or something?
It is on 12 Baldwin Street. It's actually, like I said, it's a home health VNA. Yep, absolutely. So if you need services at home, we're there. So like I said, pediatric to geriatric. So.
All right.
Okay.
Well, thank you very much.
You're welcome.
Nice
Take
to meet
care.
you.
You too, sweetheart.
Thanks.
Take care, sweetie.
Is it still morning?
Yes.
It is.
Well, it is morning.
Wow, it seems like we've been here forever.
It's been a busy morning.
Isn't it? How are you doing over here?
I'm great. I'm Diane Knight, and I direct the Northeast Tobacco-Free Community Partnership, which serves the community of Dracut and a lot of other surrounding towns in the Merrimack Valley.
Now, what do you do there?
Well, I work with agencies and organizations around the Northeast region to try to help them understand a few things. What the resources are, if there are smokers out there that would like to stop smoking, that in Massachusetts we have the Massachusetts Smokers Helpline, 1-800-QUIT-NOW.
Wow.
And it's free phone counseling to anyone that is a resident in the Commonwealth, 18 or over. And it's in multiple languages, so that's a great resource. And if you call now and you're interested in making a quit attempt, we have 4 weeks of free patches available to anyone that qualifies by calling the helpline. So
That's
they
terrific.
mail the patches to you.
So no excuse not to go.
Yeah, no excuse not to go. And I also help. I came today because I really want elders, because a lot of them are grandparents, and I want them to understand that the tobacco industry is targeting our kids with cheap, sweet, and easy to get products. Like this is a 79-cent grape cigar.
Really?
And cigar use is more prevalent in some cases than
candy.
And how about this one? You want to see something that's really candy-like. Now, what does that look like to you? Does that look like? That looks like a gel pen.
It does look like a gel pen.
It looks like a gel pen. And it's flavored. This one happens to be passion fruit.
Oh my goodness.
There are 600 puffs in that.
Wow.
And this is a nicotine delivery product. So some young people think that if you're using a product like this, it's just nothing.
No, it's not. It's not smoking, so it doesn't
it's not
doesn't
smoking.
matter. So.
Right. It's nothing.
It's a disposable
It's
hookah?
disposable hookah.
Wow.
And, there are all kinds of, products, some of them like this. But we just are, I'm trying to educate grandparents here today or parents that it's, there's a lot we don't know about these products yet.
It's so available to everybody.
It's very available. They're in all the corner stores, these products, and that's where children frequent.
Wow.
So there is a concern that young people understand how the adolescent brain is changed by nicotine, and it makes young people more apt to be using other drugs too. So we're trying to prevent all kinds of drug use today amongst young people, but this is one of the most addictive drugs there is.
Wow.
Nicotine is more addictive than heroin and cocaine. So we're trying to get the word out, and
it's frightening. Something's frightening to see that, because
Yeah.
it does look like a pen.
Yeah. Well, tobacco industry, they're good marketers.
Yeah, they're pretty slick, aren't they? Pretty slick.
They're still doing what they do well.
So now, do you have a website that somebody can...
MakeSmokingHistory.org is the website that has all kinds of information on it about the helpline, about smoke-free housing, which I do a lot of work with as well, helping. And you have smoke-free public housing here in Dracut, which is great, and hopefully doing some work. In Dracut with strengthening policy, hopefully, and maybe making it more difficult for young people to get a hold of tobacco products here.
Wow. Now, what do you have in that jar? It doesn't look too appealing.
Well, this is what the tar from the use of 1 pack a day for 1 year that's the amount of tar that would end up in your lungs after smoking a pack a day.
That's scary. That's
for a
awful.
year. So, but fortunately, our smoking rates are reducing.
down.
They are
They
going
are.
down. They're about 15% now in the Commonwealth. So. It's
That's good.
We keep
It's
up the
good.
good fight.
It's good.
Thank you so much.
Thank you. Well, good morning and welcome. And what is your name?
Lynette Gabrilla. I'm
you are?
the veterans agent for the town of Dracut.
Yay, we got a new one. We've had so many. Nice to see you here. So, what kind of services do you provide?
We mainly provide financial assistance for low-income veterans, and we also help with going through any VA claims and to kind of navigate through the VA process.
Oh, that's terrific. So now, is there a number that people can call you if they want some help from you?
Yes, I'll have to look at my business card since I'm so new.
She's new. She has to check that number.
Okay, I have it right here. It's 978-856-5007.
Now, what is the most common question that you get?
Questions about VA ID cards so that people can get veterans discounts at different establishments like Home Depot and restaurants and things like that.
Really? Yeah. How do they go about doing that?
Well, basically the only way to actually get a VA ID card right now is, one, if you have VA health insurance, or two, you have a VA service-connected disability. In 2017, they are actually coming out with actual VA ID cards, veteran ID cards for everyone.
Wow.
It was supposed to be coming out around this time this year, but they got pushed back another year.
Oh. As usual, huh?
Right.
Do you have what? Oh, well, Bob's a veteran. He uses his license, though.
Yes, that's another option. You can actually get veteran printed right on your driver's license.
He does.
If you are up for a renewal, it doesn't cost anything extra. If you are not up for a renewal and you want to get it added to your license, I think it's either $25 or $40. You just have to bring your DD-214 down to the RMV.
Oh, that's great. Well, that's good to know. Well, we're glad to have you here. What do you have? What do you have over here? And it's any brochures and...
Yes, a brochure for my office, as well as bracelets and information on the VA crisis line.
What are these bracelets now?
These ones are for supporting our veterans.
Yeah.
And the other ones are for the Lowell Vet Center.
Oh, that's great. Yeah, I'll take those.
Okay, you want this one too?
Sure. may as well get it all.
Right.
And what? And the name tag. Oh, you got name tags. Oh, there you go. Look at those.
Crisis Center.
Oh, really? Now, how does that work?
It's actually a crisis line. So if somebody is going through a crisis, is mentally unstable or thinking about committing suicide, they call that 1-800 number, and there's somebody there that's supposed to help them to...
what do they talk to them on the phone?
Yep, they talk to them to kind of get them out of their situation.
Wow. Who knew we had all this? You know, that's really interesting. Good to have.
Lots of different information in my office, so feel free to come out and join me.
So we'll tell everybody where you're located. We're at...
we're located right at the Council on Aging. My office is right here in the building, so it's 951 Mammoth Road.
So come on down and see her. Got all good stuff here. Okay, Kirk, we're out here in the ambulance now, and it's really frightening in here. I mean, I hope I never have to come in here, but...
It's home for me. It's my office.
Oh, wow.
It's where I work every day.
It's so overwhelming when you see all this in here, but it's things that you need to save somebody, so...
Yeah, there are over 150 different pieces of medical supplies in the back of an ambulance. 150.
And you know them all.
I know them all. I know exactly how much of everything is supposed to be in this ambulance just off the top of my head. I've been doing it for 22 years now.
Wow, that's outstanding. I mean, it's just so impressive. And
you're in one of our brand new ambulances. So this ambulance is only a few months old.
Wow.
It has LED lighting inside, so it's very bright.
It is.
It's very safe for the patient, safer than it's ever been.
Mm-hmm.
We have new stretcher restraints. We have a brand new stretcher. This truck has about 2,000 miles on it. So your ride is going to be smooth as butter.
Oh, that's nice. Well, should you have to get in here.
Should you have to, yeah.
It's so reassuring, you know.
If you were in the back, then you were sick, so.
Well, yeah, definitely. Oh,
like I
that's
said, this is
great.
my office.
So now where are you located? Where does the ambulance come out of?
So the ambulance is located over on Bridge Street in Dracut. We have 2 ambulances there, 24 hours a day, 7 days a week. The ambulances that are over there are actually larger ambulances than this one.
Really?
This one seems pretty big to you, but
It does.
the other 2 that are over there are box-style ambulances, so they're
the older model?
No, they're not. They're both brand new as well.
Both brand
Yep,
new,
they're both brand new.
Oh.
Yep, has all the modern features of a typical ambulance you'd find. And again, I said it's all about the ride.
So if somebody needed oxygen, you have that right here?
We do. We have oxygen. We have everything you would need. Everything the emergency room can do for you in the first 20 to 30 minutes, we can do in the back of an ambulance or in your house.
Oh, that's amazing. Amazing. So what else would you like to tell me?
That's about it.
Wow.
Unless you have any specific questions.
No, I said I'm a little overwhelmed in here when you say you see trauma and you've got the face masks. And now what do you generally use them for?
The face masks are respirators to protect us from cold and flu viruses.
Oh, that's great.
Yeah,
you need that protection.
Plus, we want to protect our patients, and they don't want to catch what we have if we.
Hopefully, you don't have anything when you come to pick them up. You know?
Correct. Correct. But we all have bacteria on our hands that we carry around with us every day.
Everywhere you go.
The other nice feature about this ambulance is it's the first time in my career that I can stand straight up in the back.
Yes, because you're very tall.
Yeah. I was always hunched over for years in the back of an ambulance.
And that's not comfortable too when you're trying to do your job either, you know, doing it like this.
Hunched over and bouncing around down the road.
That's a little difficult to do, you know.
As you know, you can feel every pothole in Massachusetts.
We do know that.
Every piece of gum in the roadway.
Especially, we have a Corvette.
Oh, there you go.
Boy, we feel everything in that.
Turn on a dime and.
It's a fun ride, but it is a bumpy one.
Yes, it is. It is. So in closing, we're proud to serve the town of Dracut. We are new to your community, but we are old in the fact that we've been around for 25 years. We also serve the Lowell, Haverhill, Southern New Hampshire, and Groveland and Boxford as well. So
So you do get around.
We're in a lot of communities.
That's terrific.
Yep.
Well, thank you very much for being here. Very nice to meet you, and thank you for the tour and all the things that you do for the town and whoever needs you.
Thank you very much.
Appreciate your service.
Thank you for having me.
Well, Donna, we have had one busy morning, let me tell you.
It has been, and from all the feedback that I've been given, everybody had a wonderful time. The seniors learned a lot of networking between the different agencies that are here, and everybody was really interested in the dummy from, I shouldn't, cut.
His name was Bob. I just want you to know.
I don't want to. Everybody was really impressed with Bob.
Yes, with Bob. The dummy. It's okay, Donna. Nukualuanui, yeah.
Look at
yeah. So introduce me to our new
This
friend.
is Noelle. Noelle is our activities volunteer coordinator.
Nice to have you.
Thank you.
She's been with us about
1 month
now.
today.
1 month today. Happy anniversary.
Thank you.
Are you having fun yet?
Oh yeah, I love it here.
That's good. Glad to have you.
Thank you.
See, she likes bling.
I need that.
She's gonna go bling shopping with me up at Charming Charlie's.
Oh, I have never been there.
Oh, we have to take her, Noelle. It's a fun place, boy.
There's our next trip.
That's the next trip?
Next trip.
I'll be on that
Take a
bus.
bus.
I'm coming.
You guys tape it? Yes, we are. Sonia just walked right in front of us. Did you see that, Sonia? What? He's saying I love you in Spanish to Sonia.
Oh, I love you too.
I don't think I know how to say that.
Do you know, how do you say that, Bob?
Oh, gee.
I can say. Oh,
Yeah.
Oh,
Easy,
so.
easy for him to say, huh? So anyway, I'd like to thank everybody who put this
I
together.
would love to thank everybody, and especially you and Bob. You're here all the time for us, and we appreciate that so much.
It was so interesting over here, and there's so much out there for everybody. I mean, not
We
just
were
seniors.
very fortunate this year. We had
many good programs.
35 plus vendors that came here
It
this
was
year.
amazing.
Very, very
really
good turnout.
And everybody's so informative, and you get some
Yeah.
goodie bags. And
Goodie bag. I know. I just
good
called
stuff
this one of the vendors. I said it's
trick or treat for adults, exactly.
so it's a good thing. It's all good.
It is
Plus,
all
we
good.
have people that have been here for years that have come back to help us out as volunteers.
That's nice.
Yep. We're fortunate. Very lucky place.
We are.
Come and see us anytime.
And don't forget, October 22nd, we have a gigantic craft fair coming up.
Yes.
Don't forget
Don't
that.
forget that.
Because
We
that
also
is...
on the 21st have a flu clinic here.
Oh, you do?
Yes, flu shots.
Oh, flu shots.
I put it on Facebook.
I'm gonna pass.
Oh no, we have a town nurse coming in with
that's
the
nice.
flu shots.
That's real nice. All right, well, thank you for having us, and we'll take this back to the studio, and it'll be on all next week, and
Yeah.
Thank you.
Catch it sometime.
yeah, catch it. Thanks. So wait a minute, wait, Bob, you gotta come over here. We gotta do our usual.
I'll go behind you guys.
Okay.
You go behind. Okay, so from your name
Noelle.
Bob.
Donna.
and Gay, thanks for joining us. Hope this gave you a lot of good information.
And we'll do it again next year.
We will. Thank you.
Thank you.